right, welcome back to another episode of the Digital Health Podcast. We have an amazing episode for you guys today, an amazing guest, Justin here. If this is your first episode, my name is Anthony Virgo. I spent the last 7 years at a health tech startup, but now I'm doing my own AI transformation for healthcare professionals and clinicians within New York and also around US, to be honest with you.
My name is Justin Ray. I reside in Chesapeake, Virginia. I own two outpatient psychiatric practices. One's called South Chesapeake Psychiatry. It's a general psych practice, and the other is Transforming Minds Interventional Psychiatry, where we do Spravato treatment. It's a general interventional psychiatry. And then I also work for the city of Chesapeake 3 days a week on a team called the Assertive Community Team, or the ACT team, where we have about 60 clients, give or take, with serious mental illness, have been hospitalized several times, maybe have been incarcerated multiple times. Mm-hmm. And so we see them in the community. They don't come to us. We do a lot of long-acting injectable antipsychotics and other, treatments in that area. And so that's my story.
All right. Amazing. Nice. First and foremost, thank you for coming on the podcast and just being open. We already have like a few, something in common because I spent a few years, my undergrad in Virginia. So I know about the 7-5 Chesapeake, and I've been to Norfolk a lot. I go out there. Virginia. I graduated from Virginia State in Petersburg, which is like right outside Richmond. So a lot. Virginia is like almost my second home.
We joke because we call it the peak. The peak has grown up a little bit. So it used to be that if you wanted a steak, you had to go out back and chop one off Old Betsy. But now you have an actual steakhouse you can go to. So we have options.
Got it. Man, I love the 7-5. I love going there, I swear. So usually we start off all the podcasts by pretty much asking a question to get a better understanding of how you actually came into the industry itself. Mm-hmm. The reason why we ask this is because we're finding like two separate themes. There's a bunch of people who knew that they were gonna get into the healthcare industry, like they grew up knowing that they wanted to be a doctor or a psychiatrist or anything, or a dentist. They just knew that, and that was the trajectory that they took from young, maybe high school and moving forward. They just knew it was a straight and narrow path. I was gonna be in the healthcare industry. And then on the opposite end, there's people like myself who was doing something completely different and then kind of fell in love with healthcare and what healthcare has done and how it's changed. So in that scenario, I have a sales background. I worked for Toyota for a while. Then I got out of the car business and then came into healthcare, which I've grown to love as an industry, not just because of, the people we serve and making an impact in the community. I love that part of it as well. But something about healthcare helped me to change my own habits and my own health habits to where I'm very conscious of how I eat, how I move my body, and a lot of that stuff. So just wanted to hear your journey and how you actually came into this industry and what kind of impact it has on you.
Yeah, so I'm the second one. I had no desire to be in healthcare when I was coming up. I mean, honestly, I can't say I knew what I wanted. I can tell you I was from rural Maine. In my mind, if I had my own apartment and drove a GTO, I would have made it in life because I didn't know any better. So because I didn't perform so great in school, more so as a choice than the fact that I was like impaired or anything. I didn't do well, and so I didn't have a lot of options. So I joined the Navy. And I was in the Navy for 22 years. I joined the Navy as a hospital corpsman because that's kind of what was available to me. And so I became a hospital corpsman. And when I went to my first duty station, being here in Portsmouth Naval Medical, they put me in psychiatry. And so I just started in psychiatry 30 years ago. I was decent at it. And that's kind of where I've been the entire time.
Wow, that's amazing. Like from going from the Army to healthcare, which I'm pretty sure it's two different, worlds, obviously. But I guess it's interesting as well, because I'm not sure if this might apply to you, because I do know Virginia has like a lot of bases and stuff like that. Right. So I'm not sure if you, I guess my question would be, is there anything that you learned in the Navy that kind of overlaps with healthcare and maybe like vice versa? That you could think about?
Well, we would say that, the Navy healthcare is much different because you have really unlimited resources, right? Mm-hmm. I mean, It's not like you have to deal with an insurance company, right? And, get prior authorizations and these kinds of things.
Right.
So it's a lot different. You're also dealing for the most part with real healthy people. I mean, people that are in the military and active duty are generally healthy, right? Otherwise, they
Right.
wouldn't be there. Of course, we take care of their dependents, family members as well, who maybe not aren't so healthy. It just depends. But, my time in psychiatry for the most part in the Navy was not really seeing really serious clients, right? Like
Okay.
the clients on my ACT team now would not be normal people you would see in the military system, right? So in the
Right.
military system, you're dealing with a lot of more just young kids with adjustment disorders and depression, missing home, maybe not fitting into their unit, and so as a result, the unit maybe kind of harasses them a little bit.
Right.
That doesn't go so well for them, and so they reach out for help. So just a completely different state of clients there than I deal with now.
Got it, got it. I understand. So the dynamic, obviously, I think there's something to maybe say about something like that because as we were saying a little bit earlier, it's like health is like a combination of things. Social and your environment being a big major part of that as
Sure.
well.
Right.
Especially in my work, I know like a lot of people in Brooklyn or Harlem or a lot of the communities that we serve, even just living in a specific neighborhood that might be like a food desert and they don't have enough resources to eat organic or fresh food.
Right.
We're seeing that like right hypertension and diabetes is spiking in these areas
Right.
because of like certain environmental kind of things that are happening. I guess when it comes to like psychiatry or anything like that, what would you say is like one misconception that the average person might not know about what you do, or even like some of the patients that you might actually interact with? Because like I always say, it's like a scenario where, yeah, or using me as an example, I've worked with so many people, client facing roles in working on the back end with like insurance and providers. A lot of the insurance company doesn't know why someone's going into the ED so many times and why they're not utilizing all of their benefits, not knowing the person probably just doesn't have a place to sleep. They're going to the ED because that's just like a default thing for them to do at night. So that's like a misconception that the average person might not know. In between, I guess, what are some things that we might not know in your world of things?
Well, I mean, so it's interesting, right? We would say that the mental health system in general is not set up really for success. And what do I mean by that? I'll give you an example. Let's say my clients who have schizophrenia and other psychotic disorders, and I never pronounce it right, they often experience a thing called agnosia, which is basically the disease itself limits their ability to understand the disease and have insight to the disease, right? So they don't have anything wrong with them. You're the problem, right? They could be
Right.
sitting there having a full conversation with somebody that's not there, but they're fine. Right.
Right.
So the thing is that if I go and see a client and he's not on medication, he's not doing well, and I feel that he's unable to care for himself because he can't think correctly because of the disease process, I can go to the magistrate, I can give them the information and say, I really think they need to be in the hospital. Oftentimes the magistrate agrees, they'll do a temporary detainment order. The person will go in the hospital. Usually while he's there, the provider goes and sees him. And of course, the client says, I'm not taking any dang meds. So what do? We do a forced
Right.
medication order to the court. The client gets forced medicated and they get better and they get discharged. But this is the thing. What people don't know is there's nothing after that, right? So in other
Right.
words, we have all these rules and formalities and stuff to get the client into the hospital. But what
Right.
happens once they're out of the hospital, right? Now we're saying, okay, well, they can make whatever decision they want to. And so, of course, they make the decision to not continue in treatment. And
Right.
then they get sick again. And then everybody's confused, right? And the thing is, we would say a lot of these clients don't have capacity. They don't have competency. They aren't able to make appropriate decisions because of the disease. But yet we have no system in place where somebody can come in and say that out loud and
Right.
kind of take control and help them make the best decision for themselves. And the thing is, there's always been bad actors in everything that we've done, right? We did
Right.
away with the institutions because, there are people doing ice dump studies and, this kind of stuff is
Yeah.
ridiculous. But the answer isn't just get rid of all the institutions, right? Because that's what happened. We got rid of all the
Right.
institutions and all we did is move them from this place to the jail. right? So now the institution is still alive, it's just in the jail, right?
Right.
So have you really served, helped any? So, those are things that probably people don't really understand, like the outside community system where we don't really have any authority. What's been established over here, we're often not able
Right.
to continue. So, we as providers have constantly and continuously need to develop techniques in order to like get our patients to understand, we have their best interests, where,
Right.
they can trust us, and it's a lot of work. But when you're successful and you see that success, I mean, I can't explain how wonderful that tends to be.
Right.
Yeah.
Right. Definitely. Why do you think that is? I guess is it like I guess from the patient side of things, do you think it's like a lack of resources or education, or do you think
Yes.
like mental health still has this like stigma around it? I know
Sure.
traditionally it does, and in some ways it will remain, but I do feel like we're in a time where mental health is now widely talked about, or at least widely accepted to go, or people are widely encouraged to go and get support. At least that's what I've observed within my few years in healthcare. Because it's like people want the help sometimes, but they don't even know that it's out there or how to kind of access it. So, what do you think? Is it? Do you think it's just the resources or education, or maybe it's just a combination of both?
I would say it's a combination of all of it. I would also say that while some people may talk the talk, they don't always walk the walk. So while they may say, like if I'm a business owner,
Right.
right, I may say, hey guys, make sure you take good care of yourselves. If you need to go get help, go get help. But
Right.
then when they go get help, they're not at work anymore, right?
Right.
So what then? So I'm
Right.
encouraging them to go get the help. They're going to get the help, but now they're not at work, and so now am I like, yeah. So sometimes we don't really back up some of the things that we talk about, like just in general. I
Right.
think it's probably less stigmatized, but I don't think it's really, mental health is really understood from
Hmm.
the common person. Like, the whole idea of just pick yourself up by your bootstraps doesn't always work, right?
Right. Right.
I mean, depression is cost the country, millions, if not billions of dollars every year in lost productivity and like, hospitalizations and this kind of stuff. An interesting fact, in maternal health, right? One IV infusion of ketamine immediately post birth will reduce postpartum depression by 50%. But do we do
Wow.
that yeah, right. But do we do that in common practice? No. But if your cholesterol, if you go in to see your primary care provider and your cholesterol is elevated, right? What are they going to
Hmm.
do? They're going to offer
Yeah.
to put you on a statin, right? But you don't have cardiac disease yet,
Right.
but you will probably over time. So
Right.
in this case, we're doing preventative measures. We're saying we don't want you to have this problem, so let's go ahead and start you on this medication now to prevent it. Why don't we do
Right.
that same thing in maternal health? We know that postpartum depression is a problem. We know that this treatment reduces depression by up to 50%. Why don't we do
Right.
that preventatively?
Right, right, yeah, yeah. That widely needs to be communicated, right? Like in terms of
Sure.
like we knowing that this problem is occurring, but there's a solution that might support it in some way, shape, or form. And you're right. I think it is. It might be that combination. Well, it is that combination of both because you have some people that might not even be looking for these things but need it, and then you have people who need it that might not even know where to actually like access or even know the questions to ask.
Correct.
So I guess I mean before we get into like the technology piece of this, I guess if I was someone who was turned off or mental health or still had the stigma in my mind or someone who just wasn't open to it as of yet, how do you I guess advocate or support someone who might be in that phase or how or what do you say to maybe initial clients that might be skeptical or might come into your practice and they're not really open, but by the end of the session or by end of 20 sessions, they're, you guys know each other on first name basis, you know what's going on and stuff like that. So I guess how do you, you from, actually doing the work, how do you make sure that people are comfortable in getting the treatment, which is also almost a stigma where a lot of people don't even talk about?
Yeah, so I mean, I'm just as open and honest as I can be, like I explained to the client that they're in my office for a reason. Like I didn't bring them in there, right?
Right,
Obviously there's things going on in their life that brought them there, and I kind of remind them of what those things are. And then I let them know that my job is not to force you into anything. My job is simply to identify the things that you're concerned about and offer you treatment options that I think can help, along with what the pros, costs, and other things are with those treatments. Because, the reality is not all psych medications are the best. I mean, we would say that people on antidepressants, monoamine type antidepressants like Zoloft and Prozac and whatever, we would say that those clients that are on those who are doing better still aren't living necessarily their best lives. I mean, 55% of them still suffer from anhedonia. But we have better treatment options now. Now, whether or not you can get that through insurance is a whole different ballgame. And so, just letting the client know that I'm not going to lie to you. I'm going to tell you the whole deal. I'm going to tell you that this medication may help, but it may also cause this, And if we do this and, if the cost is not worth the benefit, then we're on the wrong thing, right? And if you are, I'm more than happy to discuss that, make changes. In other words, I'm here to help you live your best life. And that's it. And, if you don't have to take medicines, if I give them to you, don't like them, stop taking them. You're not going to hurt my feeling.
Right, 1,000%.
Yeah.
1,000. I love that, like, transparency in between, like, someone who's caring for you and, like, the patient itself. Like, I feel like that relationship is something that it can't be mimicked or, or it needs to be there. I would say also it needs to be there for, like, patient satisfaction or patient care, or that the care is super intentional. Shifting gears a little bit into technology, so when I came into healthcare, the talk about telehealth or telemedicine was very new. Very new to the point where I didn't even see the vision. Like I'm like a provider on a computer, a doctor. I don't see it happening because it just didn't make sense. Post-pandemic, now we're in 2026, telehealth is like the thing to do. You know what I mean? And it's And I think it has its pros and cons, obviously, because on one side, right, some people might feel like we don't have that personal connection or that human not being there because we're not physically there. On the opposite side, you have someone who might think is a stigma as their first time, but now they're actually like getting a service in the comfort of their home. One, they don't even have to go through if you think about New York, a lot of people don't even go to their appointments because they have to take the train or because of the traffic and a lot of that stuff. So I know we miss at least in New York, we miss a lot of people, not solely because they don't want to come, it's solely because they probably don't want to be in the traffic or just don't have a way to actually get there. And then with telehealth, we see that is a lot more flexible. With now, we're in this age of like AI kind of coming down the pipeline kind of fast. And it's changing. You're hearing good things, bad things. You're hearing about practices incorporated it. There's some people that's not open to it as of yet. I guess, where do you sit in terms of like this new technology, AI or automation in healthcare? What are your like initial thoughts on stuff like that?
It's interesting you brought that up. I actually had a conversation with OpenAI yesterday to talk about enterprise.
Okay, got it.
So what you bring up is a great thing. So obviously in the 757, as you know, we're often separated by water, bridges, tunnels, right? So I've always said the same thing, right? I've always said that insurance very much wants the clients to come back into the office. And I believe the reason for that is because they know that clients won't access their benefits as much because of the very things you discuss. It's much easier to step to the side and get on your phone and have a conversation with your provider. You will use that benefit. But if you have to transverse the Monitor Merrimack Bridge at 3:00, you may not, right?
Right.
And so that's a real thing, right? Now, telehealth was always available this entire time. The problem is that insurance didn't pay you at parity. So like, for example, if the client was in the office, maybe I get $80. If I'm doing telehealth, maybe I only get $30. Right. And so there was no incentive to do telehealth. When the pandemic happened, we were forced into it. And so this is a great topic of conversation because what's happening now is basically everybody came to us on bended knee and begged us to help them. Please help us. We're in a crisis. So there's a lot of us who spent a lot of time, money, and effort to put this infrastructure in place, right? To, Doxy Me is a platform. There's all these platforms, right? And what we showed was that this was very, very successful, right? And it still is today. And so we should continue to utilize the technology we have to help clients, right? Because again, some of my clients don't have cards. Some of my clients don't have phones. Some, there's a variety of things that make barriers to care real. And the more we can limit the barriers, the better treatment we'll be able to provide and offer. And so we're definitely huge. So just so you understand, my main practice is a cash only practice, right? Now the reason I do that really is so that I can, what's that?
No, I was saying, okay, is that the differences between the main two? One is cash and one is insurance based?
So the city job, I'm a contractor. So I'm contracted through the city. So, we take all the insurance here. In my Spravato treatment center, we take insurance. In my general main practice, we don't. But the reason we don't is so that we can practice freely. So, because if insurance one day says, we're not going to pay you if you don't do office visits, it doesn't matter. I don't have to do that, right? Because I don't take insurance.
Right.
And so, and then I'm not getting audited all the time and them trying to take money back. And so, we're able to offer such better quality care this way. And our Google results show that. Right. I mean, we've been open for over 5 years and have a 4.9 rating. I mean, we offer person-centered based care because we don't have to be on the phone with insurance all day, right? Yeah. So we're big. We're big.
Amazing. So
yeah, go ahead.
No, sorry, I was just breaking up a bit on my end, but I guess you highlighted a lot of these benefits, or at least the intention of still using it for, if new technology is coming and it's supporting patients the best way we need to, then maybe yes, you should be open to it. Because I think what you were saying was right. Telehealth was always available, but now post pandemic, it's the thing to do, where it's not like it was never available to access. It's just the requirement to actually implement it and adapt to it kind of speeded up through the pandemic, if that makes sense. And we're thinking the same thing when it comes to AI. As you know, I build a lot of AI solutions for health practices here in New York and a few others, countrywide. And we oftentimes are stuck in between two different types of people who are thought leaders and forward thinkers, innovative, and yes, I want to implement AI, or I use AI on a day-to-day and I support this. And then we also have providers who are whoa, I don't even want to touch this stuff. I don't need it. I'm scared of it. It's not HIPAA compliant, a lot of that stuff, which are really, really great concerns, 1,000%. But we're stuck. It's really somebody in the middle. Is always someone on either side. So I guess I'm assuming you're more so on this side, where you're as long as it's supporting the patient or making the day-to-day or making the industry work more effectively and efficiently, then AI is okay with you, I guess.
Oh, we're huge. We use AI, like a champ. But what you pointed out is the bottleneck, because I can't use it the way that I want to use it because of privacy situations, right? Because, the data is used to feed the model. And if you're feeding the model the client data, you're breaking privacy, right? So to use it, I have to put in a lot of effort insofar as making sure if I'm copying and pasting information that doesn't have privacy. I can't just attach it to the electronic health record, right? And so those are challenges that we're trying to figure out. So that's why, talking to enterprise, because with enterprise, you can get privacy. It's HIPAA compliant, you sign a BAA and all those things. But it's not cheap either, right?
Right.
And do I need 50 seats? No, not really. But that's the lowest tier that you get offered. And so I think, I get on YouTube and I spend most of my time on YouTube watching AI stuff, right? Because I'm trying to figuring it out myself. And, they're currently talking about the bottleneck. So the models right now, are at the point, if people understood the models and were able to utilize them, I can't even imagine, do I need a website guy anymore? No.
No.
But because people haven't adapted it yet, and they're not quite where they probably should be, then we're okay for now. But there's going to be a tipping point, and if you're not in, good luck.
Right.
But the thing about this is, and I think what we're seeing now is there's billions of dollars going into Claude and OpenAI to
Right.
forward deployed engineers, right? Because I kind of understand AI, kind
Right.
of,
Right.
but I may need somebody to help me set up the system. Again, I don't understand the MCPs,
Right.
the whatever, and that's the part we don't have, right? Like,
Hmm.
because most people in this industry who are going to be utilizing this, they don't have the knowledge of exactly how, like what prompt do I need to use, what things should be attached, how do I do that, and
Right.
it's just crazy, like from literally from the first quarter of this year, it's just wild. A year ago, I'd put my logo in and I'd say, hey, do something with it. And it would
Right.
come back like garbage, like misspelled
Right.
words, the things
Right.
over here. I put the thing in now and I can't, it's just absolutely amazing. I'm like, oh, and this is just in a year.
Right.
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 So, and then it's like almost every 2 weeks, it's Claude Cowork.
Hmm.
Holy God. Then it's
Hmm.
it's it's OpenAI Codex. And it's
Right.
just
Right.
like, and so when you see the model and the potential and the things it can do, it's just like you sit there and you're like, oh my God. And then you hear about Mythos. Mythos got out of the
Right.
box on its own, and I'm just like,
Right.
are we heading to Terminator? What's that?
Right, right. That's interesting because it is a lot of it moves fast. There's a lot of moving parts with this
Yeah,
technology. Something we've never seen
ever.
happen. And I will always say, at least like Kazar and myself, when we're working with people, because we mainly our domain is healthcare. That's where we come from. And I always say two things. We usually say to our clients, or we usually refer to ourselves as AI transformation part. And the reason why we say that is because we're helping people transform
Exactly.
into AI. It's not a scenario where we're building an AI agent and we're like,
Right,
see you later.
right.
It's we're sitting with you. We want to get an idea. We're testing it, and then we're training everyone everyone who should be interacting with it to interact with it and how to maintain it and update it and things of that nature. So that's what we usually come from as like, you really want to work with someone who's one, I'll always say, who's in that domain or niche. So it's like, we're not doing AI for hotels and stuff like
Right,
that. Not to say
right,
I can't do an AI agent for a hotel, but it's just not my expertise. I'm not
right.
going to be able to, like, just like I know Mrs. Jones have hypertension, diabetes, but she's on the verge of an eviction, so she's not going to her primary care doctor because she's worried about paying her bills. That kind of insight is going to support in building in healthcare versus me just being a developer or software coming in with a blind
Right. So
eye,
you
not knowing how HIPAA works and all that stuff.
right.
Yeah.
So because listen, so when you are a billionaire and a Fortune 500 company owner, don't forget about me, okay?
No,
Yeah.
no worries,
No,
no
but that's
worries.
what I'm saying. That's going to be where the greatest need is in this
Mhm.
thing. Like because I can access all the models now and I can use them
Right.
however I want to. But do I know how to use them for this particular thing? So like if you have the expertise in healthcare and you can understand what a prior authorization is, what an insurance company looks like, what's needed. You understand what hypertension is, and all, so then you can go into like an outpatient clinic. They can show you what EHR they use. They can show you how they prescribe medicines. They can show you these things, and then you're able to then take the model and build out, particularly probably to their need,
Right.
and that's going to be. I mean, that's the future, really. That's going to be huge. And it's
Right.
because I don't even like who would I call? Like I'm sitting here, like who would I call to come into my office and I say to them, okay, these are all the things that we do. These are the systems we use. I'm like we had an Excel spreadsheet, right, that my office manager used, and we use it to track all the Spravato clients. So the Spravato client comes in, what's the date of treatment? What was the lot number of the drug? What was their copay? Did they pay it? What did we bill them out as? Has the money come in? What's the breakdown? And so my office manager was having some struggles with it. It was kind of messing up here and there, wasn't saving. So she said, well, maybe we need to talk about a different program or some other software or whatever. So I sat down on Saturday and
Right.
I sat on the computer and I took out the patient stuff, but the privacy information, I fed it the Excel spreadsheet. I told them what we were looking for, how we use it as a company and all this stuff. Claude built an entire program, like an entire thing. It was perfect. Not only that, but then it gave every single person the keys to get in. They were all having different permissions. It helped it showed me where to put it so that it's accessible to everyone wherever they are. And then I asked it to make user manuals for each person in whatever their role and permission was. And it was literally in 2 hours I was done. They love the system. They use it every day. And that's how it's going to be, right? So,
and that's a perfect scenario right there. You know what I mean? Like where you are using the tool, but you also have the expertise to kind of build it into it. Yeah, build it into it.
Right.
It's a learning process, and we say that, which is why I'm excited about this thing and why I advocate for. Not only just for myself and what I'm doing for a company, but it is a knowledge gap to understand this thing at the level you need to.
Right.
Especially if you're thinking about integrating it with Epic or Athena or the EHR system. It takes almost the expertise to know how it works in order to integrate it with AI. So that's just one caveat we always say is like, no matter if they're working with us specifically or you're just looking into AI, always look for someone who has the expertise in your industry who's doing the AI.
Agreed, 100%.
Because that's the only way you're actually gonna. Because you're right. We've seen a ton of stories where a bunch of healthcare companies are implementing AI, but it's coming from like maybe the top of the funnel and not necessarily where the value is actually happening at, like patient satisfaction and things of that nature. So
because they don't know. Like, see, so the thing is for somebody who's in the healthcare industry, they're probably going to bring up things that you haven't even thought about, right? Because you're not thinking about maybe this could be utilized with AI, and so the people that are coming in the office, they already have an understanding of all the things and can say, okay, so are you wanting to look at maybe using AI to build your own electronic health record? Oh, wait a second, AI can build an electronic health record, right? And so like that's super helpful to give the owners the understanding of the things that they might not even be thinking of, right? So
yeah, 1,000%. I think that resonates. So I guess, Justin, this has been an amazing conversation. I want to leave off with two last questions. One is, what's the best channel to kind of reach out to you, whether it's like YouTube, LinkedIn, Instagram? What's the best way to connect with you, just in case one of the listeners might have heard something that you said, might be in the 7-5 and want to check you out? What's the best way to connect with you? And then what's one powerful message you want to leave the listeners with? It could be something from your personal life or something that we talked about today, whatever you want to leave with us, that's powerful. So your channels and a powerful message, let us know how we could connect with you for sure.
Yeah, so best way to probably connect with me is on LinkedIn. I have a decent platform there. I do a neuropsychiatry brief every week where I'm usually discussing some medication in the pipeline, or some new thing in psychiatry treatment or whatever it might be. So that's probably the best way to get in contact with me, and I encourage anybody to reach out. And then if we need to reach out further, I can share more information. What powerful message can I give? I would say that, understand that, people struggle, right? Like people don't always have all the things that they need, to navigate life. And sometimes, they have mental health illness that also interferes, right? And so it's not always just as easy as picking yourself up by your bootstraps. It's not always as easy as, if it was so easy that a caveman could do it, we wouldn't have addiction problems, right? But we understand that addiction is now a medical model, right? Who chooses, nobody ever chooses to say, when I grow up, I'm going to be addicted to drugs, prostitute myself, lose my house and my family, and be in the streets, right? So the fact that somebody does that and continues to do so would tell you that there's something wrong, right? Like there's something greater at play. And so having that understanding maybe and be a little bit more empathetic, right? And a little bit more helpful in meeting people where they are, could do wonders, in the world generally. I mean, we're so, right now, currently, we all hate each other, right? It's the Democrats against the Republicans. It's this group against that group. It's, you support the murder of Charlie Kirk. You don't support it's like, it can be no middle, right? It's either you're either all the way over on my side or you're the enemy. And it shouldn't be that, right? We can all help one another, and we should.
Yeah, I love that. That's powerful, because in this world that we in, it's so easy to fall into the pick a side kind of thing in it. That's something I'm not even. That's a whole nother
Right.
conversation, but I get what you mean. Justin, this has been an amazing conversation. Thank you so much for your time. This has been. I'm pretty sure the listeners are gonna get a ton of value from this, and we just want to say thank you for joining the Digital Health Podcast.
Yeah, man, my pleasure. I appreciate the opportunity.